Hello friends, let us now learn some important points about the platinum compounds. Mechanism of action. The action of platinum compounds is almost same as alkylating agents because they cause DNA cross-linking with platinum, and thus they results in formation of dimers of DNA development, which will lead to cell death, and they will also cause risk of secondary cancers. So if you see the drugs in the platinum compounds, the drugs in the platinum compounds include, first we have Cisplatin, Carboplatin, and we have Oxaliplatin. This is Carboplatin is a second generation, whereas Oxaliplatin is a third generation. This Oxaliplatin has no cross resistance and it is effective against the cells showing both Cisplatin and Carboplatin. It is effective against the cells showing Cisplatin and Carboplatin. Now this Carboplatin second generation, it is preferred in the transplant regimens for treatment of refractory hematological malignancy. It is preferred in transplant regimens for treatment of refractory hematological malignancy. Now if you see the Oxaliplatin, this Oxaliplatin is used in FOLFOX regimen in colorectal carcinoma. So this Carboplatin is actually the most hepatotoxic drug and it causes bone marrow suppression. Carboplatin is the most hepatotoxic drug and it causes bone marrow suppression. This Cisplatin is the most nephrotoxic drug. So these are the important points about the platinum compounds. Next we will learn first about the Cisplatin. Cisplatin is the most wide spectrum anti-cancer drug. It is the most emetogenic anti-cancer drug. The uses of Cisplatin, if you see before that, the least emetogenic anti-cancer drug is chlorambucil, is the least emetogenic anti-cancer drug. The uses of Cisplatin are, Cisplatin is the drug of choice in head and neck carcinoma, lung carcinoma, upper GI carcinoma, in gastric cancer and esophageal cancer. It also is used in cholangiocarcinoma and urogenital carcinoma. If you see the other uses, it is also used in lower GI carcinoma like colorectal carcinoma and anal carcinoma. Actually, in colorectal carcinoma and anal carcinoma, the drug of choice is 5-fluorouracil. Then if we see the regimens where Cisplatin is involved, the regimens where Cisplatin is involved is, first, it is also used in bladder carcinoma, ovarian carcinoma and testicular carcinoma. First regimen which is important is testicular carcinoma. In testicular carcinoma, we use this BEP regimen where we can use bleomycin, etoposide and platinum compounds. Then we have second, which is colorectal carcinoma, which is FOLFOX or FOLFIRI. This FOLFOX include folinic acid, 5-fluorouracil and it includes oxaliplatin, whereas FOLFIRI includes folinic acid, 5-fluorouracil and irinoplatin. So now regimens, if you see the testicular cancer, the regimen is BEP regimen, which includes bleomycin, etoposide and platinum compounds, whereas the regimen for colorectal carcinoma is FOLFOX regimen, or we also have FOLFIRI regimen. This FOLFOX regimen include folinic acid, 5-fluorouracil and oxaliplatin, whereas in FOLFIRI regimen we have irinoplatin, that is folinic acid, 5-fluorouracil and irinoplatin. Then side effects are, this most commonly causes nausea and vomiting. Drug of choice for this is ondansetron, which is a 5-HT3 blocker. Then this Cisplatin also causes nephrotoxicity, ototoxicity. It causes peripheral neuropathy, and this will decrease the ions, especially it will decrease the hypomagnesemia, hypokalemia, and it also decreases hypocalcemia, and it also decreases phosphate causing hypophosphatemia. So it decreases magnesium ion causing hypomagnesemia. It decreases potassium ions causing hypokalemia. It decreases calcium ions causing hypocalcemia, and it decreases phosphate ions causing hypophosphatemia. So this drug can be given as slow IV infusion in order to prevent nausea and also to cause acute increase in serum creatinine. So it is mainly associated with AML 4 years or more after the treatment. Aluminium inactivates cisplatin. So if we use aluminium containing equipments, so if we use either aluminium containing equipments or needles, then these should not be used with cisplatin, because aluminium inactivates cisplatin. Aluminium containing needles and equipments should not be used with cisplatin. Next, if you see some important point, then the next important drug is about the amifostin. This is amifostin, which is used for reduction of cisplatin induced nephrotoxicity. As I have said, cisplatin causes nephrotoxicity as a side effect. So in order to decrease this cisplatin induced nephrotoxicity, amifostin should be used, and this amifostin is used to decrease xerostomia in patients who are undergoing head and neck cancer involving parotid. So it is used to decrease xerostomia in patients undergoing head and neck cancer treatment involving the parotid. So this is about the platinum containing compounds. Thank you for watching.